One of the things we're always talking about in terms of joint health, and especially around an injury or surgery, is that you have got to manage swelling. So we can't, as clinicians, really make sort of a diagnostic. We can't make recommendations if you walk up and your joint is swollen. So you're like, hey, what's wrong with my leg? I'm like, well, your knee's swollen. That's what's wrong. And I have a lot of hypotheses about why it's swelling, but as long as it's swollen, this is on you and it's not on me. Okay, right. So we know are on it. You're doing a good job. But if you show up at your doc's office and you ask her why your knee's swollen, you know, she's going to be like, well, we can do some tests, but your knee's swollen and we can't even see what the function is. So understand that if you're having difficulty recruiting your quadriceps and your knee looks like a grapefruit, right, or a big basketball, that's the problem. So first and foremost, we have multiple ways of managing this. You can pump 24 hours a day. We've got VOODOO compression without doing anything. You've got elevation. There's a whole lot you can do. You can do Normatec. We're big fans of that. Landing the boots and being squeezed. You've got your boots.
Yeah, the Rapid Reboots are great.
Rapid Reboot is a great guy. Great, another set of boots. The idea, though, is as long as the joint is effused, it's really difficult for you to get good neuromuscular control. Now, if you come into a swollen joint, I sprained my knee, and I'm already connected, I can usually maintain the connection, but surgery plus swelling is a recipe for just turning those switches off, okay? So, first and foremost, can't get my leg turned on, the thing I'm gonna ask you is your joint swollen? And if you can't answer that question,
the answer is yes.
The answer is yes. And ish or maybe, these are all analogs for yes, right? So, you know, what I can always say is look at your other knee, feel it. Does it feel like that? Is it puffy?
It's been a long time since that knee looked like this knee.
You know when you eat a whole pizza by yourself and you feel the next day, you're like, I didn't get bloated, did I? I feel you're bloated, right? So that's what's happening with your knee.
Standing there like this.
Yeah. You know, are these chins? I'm just making that up.
Look like you're ready for third attempt.
The answer is you're swollen. So here's what we need to do. First and foremost, we're going to manage swelling. Secondarily, we want to make sure that, you know, how much range of motion do I have? So we're going to say that, hey, post-surgery, I'm going to see a physical therapist, a chiro, a practitioner to work on some of my joint range of motion. So one of the things that you're going to see a provider about is to restore the intra-articular motions of the joint, which is roll, slide, and glide. So, you know, we like to think of the knee joint as this perfect, you know, hinge, and it's not. It rotates, it translates, it spins, right? You've got these so there's a lot of motion there, and if you get stuck, then that's one of the reasons that we're not getting motion. You can think of it as, hey, you need to align the door so you can walk through the door, and a lot of times we're trying to walk through the door, we keep walking through the wall. So one of the reasons you're seeing a provider is that so that they can help restore and normalize those intra-articular motions, which we call passive accessory motions, the joint motions that happen during my normal kind of cardinal planes, right? Even though there's no such thing as perfect cardinal range. So the idea, though, is, hey, if the knee is swollen, I'm not going to have good control. And secondarily, range of motion is also something that can limit neuromuscular control. Now, where we tend to see the knee being a problem is in extension. And this is one of the reasons that when you go see a therapist, that first order of business, as we tell people after a knee surgery, is first, you know, and this is, you know, of course, that you're not blocked in a little bit of flexion or something like because you've had an MCL strain. But the idea is, hey, you need to be able to extend the knee joint. And if you can't extend the joint, it's like having your elbow always flexed and complaining that your triceps is always like stiff and pain. Yeah. If you're always stuck bent, this is going to be a problem. You have to be able to straighten the joint out to normalize joint function. And particularly in the knee, we're going to see that people who are stuck bent, or the technical term would be missing terminal knee extension, that is one of the uphill battles towards getting your quadriceps turned back on again. So go and lay down for me real quick and I'll show you what I'm talking about. So here's a simple test. Lift your left heel up off the ground by flexing your quad. So that's terminal knee extension, and everyone has between 0 and maybe even 7, some people even more terminal knee extension than others, but everyone has some terminal knee extension. So when he flexes his quad, his heel comes up off the ground. And I'll sit up for you and I'll show you what it looks like on, I'm not gonna say I'm a normal person.
A non-broken.
Right, but notice that as I hyperextend my knee, I can lift the heel up off the ground. So let's test the other knee now. Ready, and Lift it up off the ground for me. Right. So what ends up happening, and Matt's got a great quadriceps on, but he does not have the ability to fully extend the knee.
Not anymore.
Not anymore. And so there's a couple things we can ask. One is, does he have the function in the knee? Is it a bony end block?
Yep.
Or can I take him to end range and work on those things? So for the typical person who is coming back post-knee, scope or problem, they have the capacity to actually straighten their leg out. They lose it because the joint has a little bit more space to swell when it's slightly bent. And that's one of the reasons that that joint ends up in that position, and then it gets stiff. So this is why your therapist is obsessing about returning your ability to extend the knee, and why one of our best videos that's ever performed on MobilityWOD is VOODOO terminal knee extension, where we wrap the knee, and we'll link to this, we wrap the knee, and then you can grab the shin, internally rotate the shin on your own body. So I would grab the shin, internally rotate the shin, press down as I did a quad set. So what happens is I'm able to internally rotate the tibia on the femur, which is what? External rotation of the femur on tibia, but in this case my foot is open. So if I grab the tibia, internally rotate a little bit, and then flex, I can actually press down into extension and normalize that function. So the key here is that even if Matt is missing some, I bet that there's still a few degrees in there that we can chase to get this knee back on, right? Because what we're assuming is it's got to be like that. We know it's not like this leg, right? This is my reference limb, but we want to make sure that it's 100% for him. So no matter what, we're always chasing those last bits. And it's something we're going to focus on in terms of a mobility piece, right? A mobilization. We're going to make sure that he actually is keeping his eye on that terminal knee extension. Oftentimes, the therapist will get it. It looks great.
Yeah.
And you go home and do something knuckleheady and stand on it at a party like Halloween, and lo and behold, it goes away, and the next day your leg turns off. So keep in mind that crucially, that range of motion matters, as does stiffness through range of motion. So we've got swelling, we've got this terminal knee extension, right? We know that ultimately restoring your flexion is going to be important so you can squat. You're going to need to be able to squat down. But then also we're looking at what's happening with stiffness through range of motion. So if his quads are stiff, if the hamstrings are stiff, if he's eating and it's resistance exercise to eat, then that's creating additional shear loads on the body. So this is why it's easy always with that straight limb to smash the crap out of the tissues, working side to side, do the tempering, do the smashing. You even did this thing called mobility sleeving.
Mobility sleeving, yeah.
Where you put a wrap on a kettlebell so you could smash the crap out of your quads.
I did, yeah.
Right?
Works
so
great.
that works great. And that's exactly the kind of thing to do at home while you're watching Stranger Things on Halloween.
Indeed.
Right? But understand, if your knee is swollen and you're missing these fundamental positions of the joint, I guarantee
you got steps to go back before you start doing that.
You're just not going to get the quads to turn back on. Right? So, and that's really how we're thinking about unleashing the knee. We often hear athletes say, hey, I can't get my quads on. Lo and behold, their knee is stuck bent. We restore that motion, and guess what? Bam, quad just turns back on. And we get them squatting again with good neuromuscular control, and we reinforce that position. Now, Vincent, people are going to have surgeries.
They're gonna, and they're not a lot of fun. My recommendation is stay focused on the things you can do. Don't get caught up, don't get bummed out by the things that you can't do. Those can be addressed down the road. Stick to what you can, do lots of it, be smart, keep working.
Did you ever, I think we mentioned this, did you see the movie Unbroken?
Unbroken or Unbreakable?
Unbroken.
No.
So Unbroken was where Zamparelli, in World War II, he's the guy who gets on the raft, and then he's tortured in the Japanese internment camp.
All right.
Right? I think it was an Angelina Jolie joint, but it was a great book by, I think, Laura Hildenbrand. And he was an Olympian, ran the mile in like 4:02, 4:03, was shot down, survived a month in a raft eating like seagulls, was tortured by the Japanese where they fractured his ankle. Bad stuff happened for like months and months and months and months and months. He came back and ran a 4:05 mile. So my point is, if you're great, you're always great. Your body knows how to go fast again. You just got to give it time. Even after all that guy ran a 4:05.
Right.
So what's your excuse? I'm broken. See you guys tomorrow.